Let's discuss the impact of this outbreak then on public health and how it's likely to affect the most vulnerable in our society. We're joined by Dr. Edzane Mphaphuli. She is a public health medicine registrar at the University of Pretoria. We're talking about vulnerable groups here. As far as you're concerned, which are those that you've classified?
So generally, in the epidemic in general, what the high-risk groups have been identified to be is those who are over the age of 60 years old, those who are immunocompromised for any reason, so who are on steroids, and in our country will be those who are on HIV, those who are undergoing cancer treatment, and who have any other immune deficiencies. And also patients who've got immune deficiencies because of comorbid diseases like diabetes, hypertension, and cardiac diseases. So those groups with comorbidities have been identified as the higher risk groups. I guess the HIV group wouldn't be identified as yet because the countries that have been affected so far are not having the high burden of HIV that we have in South Africa.
I want us to look in particular at this age matter, because you're saying people 60 years and above. That points specifically to the elderly in our country. When you look at how we could be responding to this in a way that also then ensures that they're safeguarded, do you think the immediate interventions that could be in place? I mean, countries like Italy have said the elderly should stay home, people will do their groceries for them. Are we at a point where we need to start implementing such interventions?
Yes, I think it's very important that we learn from what other countries are doing, and we need to actually start looking at that and making sure that we safeguard those who will be most vulnerable and put the most pressure on our health system and prioritize them. So yes, social solidarity matters, like making sure that people go and buy groceries for the elderly, making sure that our elderly are aware of what's going on. Sometimes they might not be on social media, they might not be listening to the radio, so it's very important that we make sure that we find ways to communicate to that age group so that they are aware of what's going on, and also that they stay at home. And more importantly, I think it's the young people who will then carry disease to them to be very cognizant of when you're going to meet an elderly person. Make sure that you've not been to a country where there's a high burden of COVID-19. Make sure that you know your contacts. You don't want to put that elderly person at risk. If you're coughing, rather don't go and visit that old elderly person. So I think it's more about those who might be at risk, who are not elderly, taking their responsibility and making sure that they don't expose the elderly unnecessarily.
Of course, the elderly play a critical role in South Africa's social structure. Many of them are taking care of grandchildren at home, and many of them, quite frankly, are having to fend for these minors that they are looking after. So it might not be economically viable for them to stay at home.
Yes, and I think probably they already do stay at home as it is, but keeping the children away from school, that's a very commendable measure, because the children who are going to go to school, get exposed, and bring back this virus back to their grannies, who are now their caregivers. And I think maybe the important areas to consider is when they actually get their SASSA grants, how do you actually control that crowd and make sure that within that space they are protected. So I think those are proactive measures that we could look into as a country to make sure that the outbreak is contained. And when we know that older people are going to be aggregating, how do we stagger this process of their gatherings, particularly around them going to get their SASSA grants? Because generally they are at home looking after our children, and it's us who are going out to bring the disease back to them.
All right, sure. Thank you so much for your time. And of course, later on News at Prime, we'll be speaking to Minister Lindiwe Zulu about exactly how pensions then are going to be affected and distributed going forward in the coming weeks.